So good morning. My name is Leigh Pate. Well, that's not me, but that's her. Well, I can't be here in person today. Thank you for the invitation to be here virtually. When I was diagnosed with lobular breast cancer in 2011, there was very little information available. Research was sparse and often outdated. There was very little interest within the research or medical community in lobular carcinoma, or very little understanding or appreciation of the experience and challenges faced by the tens of thousands of patients diagnosed with this unique type of breast cancer every year. There was no advocacy voice for patients with lobular. But times have changed. Today we have a growing and vibrant lobular patient advocacy community worldwide, actively partnering with a growing and talented group of committed scientists and researchers. We are all working together to unravel the mysteries of this disease, refine the treatments currently being offered to patients, and identify new targeted therapies. Today there are dedicated organizations in the US and in the UK who are partnering with researchers to raise funds, educate communities, support patients, and build scientific interest in researching the disease. We also have a growing network of advocates throughout the EU and through LBCA that is expanding to drive interest in research of lobular breast cancer throughout Europe and spread knowledge to patients. And independent advocates around the world are partnering with lobular researchers as local research institutions to raise funds for research, help with grant proposals, studies, and trials. All advocates focus on raising awareness and educating about this disease to increase the sense of urgency, to take action and build momentum for change to address the challenges of this understudied breast cancer. As we know, patient-partnered research equals better science and faster progress towards our common goal to save lives and reduce suffering of the hundreds of thousands of patients who were diagnosed with or are living with lobular breast cancer. The paper published in Cancers that will be discussed today by Dr. Steffi Österreich and Claire Turner outlines eight challenges we face in advancing lobular breast cancer research that can be met and overcome with collaborative efforts between researchers and advocates. In this presentation, we will highlight progress so far and suggest potential opportunities for the next steps. I hope that during the 2022 symposium, you will take this opportunity to seek out and meet the advocates and researchers who live and work close to you, introduce yourself, and open the door for how you might work together when you return home. Lobular breast cancer is a little breast cancer in the big breast cancer world. It's only by working together and working collaboratively we can continue to make meaningful progress in the next decade, so patients finally will benefit from personalized therapies that truly meet the challenges of this disease and the opportunities to save lives. Thank you to everyone here for your commitment to research of this disease and advocate for patients.
For many years, lobular was basically just considered another estrogen-positive breast cancer. And it's really important for patients working with researchers and clinicians to try to move out of that mindset and to identify the research needs that are really impacting patients and what it is that some of the shortcomings of the current practices, and then how to move forward. I was so struck as a patient about the lack of information and the lack of appreciation for a patient's experience and drive and urgency to make changes in that. It really motivated me to make a change.